Hello everyone, I'm Genesis here at Torrance Oral Surgery Center. Today I'm going to be making a quick video of our post-operative instructions for you guys. Bleeding. Bleeding after surgery is normal. You're going to be firmly biting on a piece of gauze for about 45 minutes to an hour. The way to determine if you're actively bleeding, you're going to take a look inside of the surgical site. If you feel blood is arising, which means you would have to place a new gauze and bite down firmly for another 45 minutes to an hour. If this is not the case, no need to replace the gauze. Rinses. You will not rinse for the next 24 hours after your surgery. After those 24 hours, you're going to start rinses with warm salt water every 2 to 3 hours. After the 6th day, you're going to vigorously rinse with salt water to help keep the surgical site food-free from anything that you're possibly eating. Pain. We advise that you take your pain medication before the numbness wears off. Swelling. We will provide a head wrap and cold compress. This combination should be used for the first 48 hours to minimize any swelling. At times, difficulty in fully opening the mouth will follow after the removal of impacted wisdom teeth. As the swelling resolves, a normal degree of opening will return. Eating. For the first 24 hours, you're going to be on a liquid diet, such as smoothies, shakes, yogurt, smooth broth, and jello. After that, you will be on a soft, mushy diet for 6 days, such as mac and cheese, pasta, yogurt, mashed potatoes, eggs, fish. Things that you should avoid. No extraneous activity for 7 days post-surgery. No swimming. No lifting anything heavier than 10 pounds. No smoking or using a straw for 1 week. No exercising for 1 week. Sutures. Sutures are resolvable, so they will fall out on their own, unless told otherwise by the assistant or the doctor. Antibiotic. Majority of our cases are given a dose of antibiotic before surgery. If the patient was administered penicillin, the next dose will be in 8 hours. If the patient was administered clindamycin, the next dose will be in 6 hours. Usually ibuprofen is prescribed for mild to moderate pain. We recommend taking as directed for the first 5 days. This will help control pain and inflammation with swelling that you may possibly have after surgery. Norco is prescribed for severe pain. We recommend taking this as directed only if the pain does not resolve with your ibuprofen. Always remember, if you're taking Norco, there is no driving or going to work. The doctor will prescribe a steroid pad called Medrol Dose Pack. If you had a morning appointment, you will spread out 6 tablets throughout the day. If you were here in the afternoon, you will take 3 tablets when you get home. 4 hours later, you will take another 3 tablets. Mouthwash. You will be prescribed a bottle called chlorhexidine. You will begin that 24 hours after your surgery, morning and at night for 7 days. I hope this video answered a few of your questions. Always feel free to reference back to our post-operative sheet that we give you after your surgery. If you have any questions, feel free to give us a call to our office. Thank you.